Hi guys and welcome. Oh, wait, it looks like our stream has been deleted from Facebook. I am just making sure that everything is connecting.
Okay.
Give me 1 second, guys. There we go. Hold on, I'm going to have to edit this. Jim,
Okay.
we are live on some platforms. So as I sort out this technical issue,
I'll be careful. I'll be careful what I say.
Can you please introduce yourself and just chat to us a little bit about your journey and the Masterson Method?
Yeah. So I'm Jim Masterson, and I guess I'll just start from how I got started doing the Masterson Method, and I was grooming. This was about like in 1998. I was grooming hunter show jumpers here in America, hunter jumpers that we call it, and for a show barn. And we were on the road a lot, traveling, to different shows. And I noticed that it was my first introduction to that world. For starters, I'd had horses as a kid and at various points through my life, but nothing professional, just fun. But I noticed trainers would hire massage therapists to massage the horses and chiropractors to adjust horses. And I noticed that I was never interested in doing any kind of massage therapy. But what got me curious was that when they were working on horses, the horses would elicit different changes in behavior or expressions, like letting out a sigh or shifting weight from leg to leg, or licking and chewing, dropping their head, licking and chewing. And one thing that really got me was the blink. That's a very subtle response. And what got me to notice that was we were at a show in Estes Park, and the trainer hired these two ladies, one to massage the riders and one to massage the horses. And I was watching her massage the horses, and she started by running her finger very lightly down this line called the bladder meridian. So it's a traditional Chinese medicine meridian. Apparently it's one of the main meridians. All the other meridians associate with it. And so she would run her fingers lightly down that to relax the horse and kind of connect with the horse. And the horse would drop its head and it would just relax. And but I noticed every once in a while the horse would blink, like a clear blink, wasn't caused by a fly or anything. And I saw the horse. I thought, I was thinking the horse is feeling something right at that spot. And she would continue going on. And so I asked her to show me some things, some massage things, and the trainer paid her to show me some things and what some of the muscles were. And then she showed me how to do the bladder meridian. And when I did the bladder meridian, I ran my finger very lightly down, and I would watch the horse's eye. When I got to a point where there was a blink, I would just stop and wait there and not do anything, because the horse was feeling something. I wanted to see what was going to happen. And I noticed that if I stayed on that spot without pushing on it, without putting any pressure on it, what I was doing was just keeping the horse's attention on that spot. That after a while, the horse might drop its head, might start to lick and chew, it might yawn. Obviously, the horse had relaxed and released something. So that's one of the things that got me interested. And then another was in Lexington, Kentucky, our trainer hired this old guy from New Zealand. He lived in California, but he was a old horse chiropractor from New Zealand. He'd been doing it 40 years, adjusting them, very long lever, forceful techniques. And he learned from another old guy in New Zealand who'd been doing it for 40 years. So that was his education, like he'd probably done thousands and thousands of horses, but he did these key adjustments, long lever adjustments. Then he'd step back to see what the horse had to say. He didn't just keep going. He stepped back to watch the horse. And one of his indications he got a good adjustment was the horse would stop and kind of drop its head and start yawning repeatedly. So that was his indication, one of them, that he got a good adjustment. Then he could go back up. Hey, pups. He could go back up through the neck, for example, and everything's moving, and he got a good adjustment. So that intrigued me, and I would follow him around whenever he was at a horse show. I would drive him to the different barns and hold the lead rope, and just to be there and learn. And he didn't share a lot, because these old timers kind of play their cards close to their chest. They don't want competition. But he and I got along well, and I would ask questions and he'd answer them, and he'd let little things slip, little key gems of information. And so I wanted to do what he was doing, and I wanted to apprentice with him, but he didn't train people, he said, he said, just keep doing what you're doing. You know, you have a good feel. And I wasn't adjusting. I didn't want to hurt the horses. And a lot of people would watch him and then they start going around adjusting horses, you know, horse chiropractors. But, you know, how many horses in the process of learning can you hurt doing something like that if you don't know what you're doing? But anyway, so what I did, I started working on our Barnes horses, and I would do, there's two types of techniques that we use in the Masterson method. One is very light, using no pressure at all, and just going over certain areas of the horse, searching for the responses, which would a blink, the head drop a little bit, an ear move, any lips will twitch. Some horses are blinkers, some are lip twitchers, but any subtle change in behavior as you're doing that correlates with what you're doing. That's the key. You know, horses always blink, but if you're going over the horse somewhere lightly and you get a blink, if you're not sure it's you or something else, go back over it. And if you get a blink at that exact same spot, then there's a correlation that means something. And so we have those really light techniques, which are super, helpful. They help the horse release like really deep core muscle tension. And then we have movement techniques, and all the movement techniques are moving through different areas of the body in a relaxed state. For example, starting at the pole, asking for gentle movement side to side, soften, go down to the next vertebra, or down just anywhere down the neck, ask for a little movement, soften. And when you hit a spot where there's tension in that range of motion, as you ask for the movement while they're relaxed, the horse will brace. And then when he braces, you soften. And then the horse releases some of that tension when you soften, and then you can continue through it. So you're actually working with the horse. You're not working on the horse. You're working with the horse's nervous system to help it release tension. So that's how I got started. And then I hooked up with a guy in Wellington who was also doing body work. And he had been working as a vet tech for 20 years for a really well-known vet on the East Coast. And he left the vet practice to do body work in Wellington. In the winters, it was Wellington, Florida, West Palm Beach. There were 3,000 or 4,000 or 5,000 horses there, you know, for three months. Huge opportunity, and Bill needed help. So I was down there trying to build my business one horse at a time. Maybe I had 10 horses a week or something. And all of a sudden, Bill said he decided to hire me. And he said, how many, Bill Stanton's his name, really good body worker. He said, how many horses can you do in a day? And just tell me honestly, you know, no rush, just how many can you do in a day? I said, okay, well, I can do 5 or 6 a day. And he said, that's fine. Don't rush. Just do 5 or 6 a day. Well, the first day I did 13 horses. Like it's at the height of the show season. Just go in and get them relaxed, get their muscles feeling good. Go to the next one, you know? So, for, you know, every winter for 2.5 months, he and I would each average 50 or 60 horses a week. And so that's huge education, just working on so many horses, on biomechanics. I mean, it's just, you're not studying anything. You're just learning. So I did that for 9 years, and I started teaching people because when I was out working, you know, come back to Iowa and work at home and try to find clients. And then when I would go to different shows, owners would ask if I taught it, because it's very interactive with the horse. That's a cool thing about it. You're working with the horse. You're paying attention to the horse. The horse starts to trust you when it knows that you're listening. And so I started doing weekend clinics, and then started doing it 5-day courses, and eventually it turned into a certification program. A lot of massage therapists would come, you know, they liked what they saw, and it got results, which is the main thing. And they wanted another tool to add to their toolbox, because it integrates really well with any other modality. If you learn to start getting feedback from the horse with any modality, it's going to help. It's going to make it better. So it eventually turned into a teaching business.
Okay, I love that. You've said so many things that I'd actually love to go into deeper. You spoke about the two kind of primary techniques or spaces, which would be the light touch and then movement techniques. And then I want to, before we go into those though, you say that in the beginning, as you started coming into this, you worked for someone where you just got the hours in, and just so many horses, more horses than you would ever have seen had you just done it yourself.
Huge opportunity. Right? Yeah, I was very lucky.
And the way, like, that is just such an incredible way to learn, is the more we can get our hands on horses, the better. And this is a recurring conversation I've been having lately that I just want to share with our community, because if you are new in the industry, you've just qualified, so many of us start our own businesses right away.
Mm-hmm.
And I think if you can work for someone for a year or 2 or 3 years, get the experience, get the caseload. Don't struggle with the business stuff to start off with. Just get the caseloads in and then go, okay, that was my tangent.
I
We've
want
been having so many conversations around that.
Yeah.
So yeah.
Yeah, can I add? I can just add to that. And by the way, I'm not limited by time today. I have all morning, so I don't know what your thing is, but time restraint. But when you're starting out, you're going to build your business one horse at a time. And like you said, don't get too focused on all the business, and just start. You want to have your business set up, and a website is good. Social media is good. You know, if you can have people either videoing you working with horses or I don't know, anything that you can think of, but it's one horse at a time. And I would work on horses for free, you know, when I wasn't at the shows. I wouldn't work on them for free at the shows. But if you want, because it's good education for you. But I'll just share. Don't work on a horse for free, expecting that person to hire you later, because I found it didn't work that way. I work on horses for free because I want to work on the horse for free. You know, I want to help the horse and help the owner, and I want to learn more. So I'll do that. But I found that when you work for free too much, like with for someone, I'll do your horse for free, and then see if you like it. Sometimes that works. Often that doesn't, because they see that you don't value your work, so they don't value your work. So. And then you're going to get clients. As you build your business one horse at a time, you're going to get a client. They're going to want you to schedule another appointment. They'll get you on regular. You'll get another client. It'll go like that. Then you'll lose a client because something will happen. You know, either you're going to get clients, and then you're going to lose a couple. It's just the way it goes. A lot of people, you may get amazing results with their horse and know they love you, but then 2 months later, something else comes along, you know. Some other person or the latest thing. Some people want the latest thing. Some people will just stick with you because they see the value of it. So don't get discouraged, because that's the hard part. When you lose a client or they don't call you back, you get discouraged. Well, that's not you, that's them. So that's my advice.
Yeah, I love that. We shouldn't take it personally, because it isn't about us. It's about them. Yeah, I love that.
And who knows what they're thinking or what their motivations are. But as long as you're helping the horse, it's about the results. And most people are going to see the results.
Exactly. Thank you. Guys, if you're joining us live, let me say hi, because I didn't do that properly. We are chatting to Jim Masterson today from the Masterson Method. And I hope everyone knows who that is, because I certainly know who that is. Jim, you've just been, like such an inspiration for so many of us. So it's really, really great to be able to meet you and chat to you. Hi, everyone. So I have Afton, Nadia, Lot. Hi, guys. It's so good to have you with us. If you're joining us live, please feel free to ask your questions. Anything that you want to chat about, anything that you want to understand better, questions for Jim, let's ask them. This is the platform for that. If you have watched our free birthday webinar this month with Jim and Vanessa Helvey, it is about gelding scars. If you have any questions left over from that, feel free to ask them now, and let's chat about it. I think that would be a really great topic to get into today. Okay, so hi Nod, super excited to be here. It's great to have you. All right, so let's talk about the light touch, Jim, because you have a different way of describing it. Usually we will grade our palpation on a scale of 1 to 3, for example, but all of that is, it's deeper palpation. It's a scale of from touching to deeper palpation. Yes. So chat to us about how you define pressure and how you define that light pressure, and why you think it's so impactful to lighten the pressure instead of deepening it.
Yeah. Okay. So when we in our certification training program, we do an initial evaluation. We palpate the horse. We want to add pressure to see how the horse reacts. So for example, on a scale of 1 to 3, if you start like up here behind in front of the atlas, you start to add the pressure. You want to go to as much pressure as it takes to see if the horse is sore there. So you slowly increase to like what I call line pressure. The levels of pressure. First I call air gap. The second I call egg yolk, which, you know, barely touching. The third I call grape. They all have to do with food. Sorry, how much pressure to squeeze a grape, and then lemon, which is getting harder, and lime is about the hardest you can push. So if you're palpating, for example, you want to slowly add the pressure to see if you want to see if the horse is sore there. So you need to increase the pressure till you get a reaction. If you get no reaction, there's nothing there. If you're at grape and the horse reacts, then he's very sore. That's a 3, okay, for example. And so that's for the purpose. We just go over the horse to see where they're muscle sore on the outside, because you'll start to identify muscle patterns that might point to what's causing the soreness. And I won't linger too long because I don't. Do we have extra time, or is it an hour or 45 minutes, or can I go on longer?
we can play it by ear, but
Okay,
I think we should aim for about 45 minutes to an hour.
So anyways, so we're just looking for pain on the outside. So muscle tension patterns might show up. For example, if a horse has a sore right front foot, he might be reacted at the right atlas, and it might be, but anything going on in the body creates this tension in the pole and atlas. Any discomfort, it shows up in the pole. So it could be feet, could be saddle fit, could be or sore back, could be dental issues, could be hind end issues. Any discomfort, it shows up in the pole in some way in general. But if you get a reaction at the pole and you get a reaction at, for example, the pectoral muscle on the right side, those are 2 things that point to possibly it's the foot. But if you get a reaction at the left hind on the diagonal, there's 3 things that point to possibly a foot, as an example. So you want to see what the tension patterns are in the horse, or just where they're sore. They're extremely sore behind. You can barely palpate. Well, that's significant to know. All right. So you know something's going on. It might just be work. But that's the kind of pressure we use to palpate to see where they're sore in the initial evaluation. But also in the work, in the body work, there are certain techniques, the very light ones, where you're just using air gap. And then there's other techniques where you're asking for movement. And the movement always has to be in a relaxed state. Movement down the neck and the poll, movement of the scapula, movement of releasing the hind legs, which is about relaxing the pelvis. All of that movement in a relaxed state is that when you move a joint or junction through a range of motion in a relaxed state, you're going to release tension in the connective tissue around it. And you're also going to find where the tension is. So the example I gave before, going down the neck, gently relaxing lateral cervical flexion, wiggle here, move your hand down, wiggle here. When you hit a spot where there's tension in a joint or junction and you ask for the relaxed movement, the horse will react and brace. And when the horse braces, you soften and they release some of that tension. So you can use pressure with this method, but the key is you're not going beyond their internal bracing response. And so if you're going beyond their turn, if you're just pushing down the neck, you're not going to find anything and you're not going to release much. So the movement and the using pressure involves staying under the bracing response or finding where the bracing response is. That's where they're sore. So that's the movement techniques. And the other techniques are just searching for a subtle response with no pressure, like a blink, lips twitch, and waiting there until the horse's nervous system goes from the sympathetic to the parasympathetic. And early on, I recognized, early on when I knew even less than I know now, I recognized that there's a part of the nervous system that holds, braces, and guards tension, because I was working on show horses, they're all tense. There's a certain level of certain part of the nervous system that holds tension and a certain part that releases tension. And so, as I've learned more now, especially working with Dr. Peters, there's a certain level of sympathetic activity that's in the horse, even in the resting state, because they're just blocking out tension, because that's how they survive. They can't complain. They can't go to the chiropractor on their own. They block it out. And so it's there. And so when you're doing the light touch, for example, you find a spot where they're feeling something. If you just wait there without putting pressure, the sympathetic will start to let go and the parasympathetic will kick in. And then when they release the tension, they drop their head, they'll give you more signs. They'll lick and chew. They might start yawning. They shift weight from leg to leg. So it's the nervous system that you're using to help the horse release tension. Does that make sense?
Yeah, that does make sense. I love that. You're just throwing down huge gold nuggets here, and I think that's really fantastic. Thank you.
Yeah, well, we don't have that much time, and I want to share as much as possible.
Thank you, Jim. Okay, so guys, welcome. It's so good. We have South Africa, from France, from KS, I don't know where that is, and NC, I don't know where that is. I'm going to assume somewhere in America.
Okay.
Wisconsin, Arizona, what else? Portugal, Colorado, Michigan. Wow, this is amazing. This is so cool. Thank you guys for joining
We have a
us.
lot of states.
In America, that's
Yeah.
as good as it gets for me.
Yeah.
So Corey says, I'm very interested in learning how to listen and learn from the horse during the Masterson method. So can you take us through that, like that feedback, the listening, and then responding, and how that works for you?
Yeah. When you're using the light touch techniques, and by the way, on our website, somewhere on there, there's and on YouTube, we have YouTube videos, where I'm working on horses, showing this. But there's a video on the website. I think it's about 17 minutes long. It's free, on doing the bladder meridian and what to look for. I mean, not any. It's called light to the core, or the light touch, but the bladder meridian is. It tells you how much pressure to use and what to look for. But how it works is, like I said, if you go over the horse anywhere on the body, but we start with this line called the bladder meridian, and you go very lightly. That's the hardest part for people. They think light means pushing on something, but you go barely touching the hair, and watch for subtle change in the horse's behavior, such as the most common is the blink. Some horses' lips will twitch a little bit, or the ear will move, or the head will drop a little bit. It's any subtle change in behavior that it shows you the horse is feeling something under your finger, almost hair by hair. And the most common is the blink. And I was explaining earlier to Annie that if you're not sure the horse is blinking, you got to go slow. And if you see the horse blink, if you're not sure it's you or it's something else, just go back a few inches and slowly go over that spot again. And if he blinks at the same spot, that means there's a correlation between what you're doing and he's doing. So that's what I mean by listening to the horse and following the horse's responses. You just have to trust it too. So the next step of waiting there and doing nothing, not pushing, nothing, just wait there and start talking to your friend or something. Just not expect anything, and see if the horse at some point will start to relax and release the tension. And those signs are licking and chewing, dropping the head, shifting weight from leg to leg. Sometimes the horse will just take a deep, just like they let out some tension. So you're following those subtle changes in behavior, and you have to trust you have to make the connection and trust that it's working, and then you move on and go look for another spot. I think that was her question.
Yeah, that's perfect. You also answered Natalie's question, and Ellis, thank you for also answering Natalie's question. That was great. All right, so my question, you mentioned tension patterns that you pick up, and there are some common tension patterns. So you pointed out that if you're finding tension, I think you said in the pole and then the pecs, then it's pointing you towards the hoof or the front limb. I could have got that wrong now.
Yeah.
Can you share some more of those tension patterns that really stand out for you, or that make an impact for you, and that you would love for us to be aware of?
Yeah, because there's one thing is to help the horse release tension, but if you can help find what's causing it, then ideally it won't come back. And it's more complicated than that, because there's a lot of other stuff that could be going on. But so there's a few tension patterns that when you're working, especially on horses that are training or competing, these tension patterns show up more clearly, because they're like an athlete and they're doing using their whole bodies, and they're fairly healthy and not stiff. So if you have an old horse that's very stiff, these patterns, it'll be harder to find. But with a horse that's working, they're easier. But that said, even, I'll give you an example. The one, and I'm sharing a lot of stuff that we teach in the certification, but I'm happy to share it because it might help you, and you might want to come learn more. So who knows more. But anyway, so the feet are a big deal with show horses, with any show horses, but with hunter jumpers especially. Most of the weight of the body's carried on the front, as so when we palpate the horse and go over the horse with palpations or looking for responses, if a horse has a sore foot, one front foot or one or the other, he'll probably might find tension in the pole and atlas, just between the occiput and the atlas when you palpate there. Or it might be extremely head shy if that's an extremely sore foot. But the pole and atlas can be anything in the body creates tension in the pole and atlas, anything going on. So it doesn't always mean the foot. But if you get a reaction on the left hind when you're palpating the gluteal or the sacrum area on that diagonal, if you get a reaction there, there's two things that point to the possibly the front foot or maybe the left hind. But if you get a reaction at the pectoral on the right front, then that's three things that point that possibly the right front foot is hurting. So that for us, Masterson Method practitioners, that diagonal is important when you're working on the horse, because horses compensate on a diagonal and they also compensate side to side. So we're paying attention to which diagonal the horse might be reacting on, the right front, pole atlas, left hind, and the gluteal. Because if there's a big reaction in the right front and a smaller reaction in the left hind, that points to possibly the right front foot. And then the pectoral, right where the girth is, points to will get sore when the foot's sore too. Now, if you're working on sport horses, that'll show up really clearly because they're working, 6 days a week. If you're working on an older horse that's been stiff and might have sore feet or sore foot for a long period of time and it's chronic, then those pain reactions won't show up. They're just going to become restricted and tight. So just to keep that in mind. So that would be like one of the key ones that of tension pattern that which and feet are important. So those are one of the key ones we pay attention to. There's when if the horse has a sore back from a saddle, in my experience, they're often sore right on top of the pole because they're going away from the pain. They're going like this. Now, if it's been sore a long time, they might just be tight there. Over time, the pain goes away and it just tightens up. So restriction and pain are two different things. If a lack of movement or range of motion is caused by pain, they're going to be sore, and it means that whatever's causing that soreness is there right now. If it's just tight and locked up, it's either a chronic problem or an old problem. So that's helpful to make that distinction between pain and restriction, because pain means something's going on right now. Restriction means it's older or chronic. Does that make sense?
Yeah, I love that distinction. That makes it really easy to remember and differentiate them in your mind. Yeah. So I think that's great.
Yeah, like if you
we have a really interesting question here.
Okay. Yeah.
Sorry, carry on, Jim.
No, I was just going to say, if you're flexing the front fetlocks and you get a reaction when you flex it, something's going on right now. But sometimes you flex the front fetlock and it's just very stiff and not a lot of range of motion. That's an old injury, so that it's like that, that restriction is just old. Okay, carry on.
Okay, so from Honestly Horses from Oklahoma, I have a mare that pins her ears and shakes her head as soon as she's touched. I'm trying to apply your method and I'm seeing some improvements, but I would love to know how to help her more. I love that question because, this month we're talking about gelding scarring, but mares really need like their own spotlight. So can you talk to us a little bit about mares? I have a mare just like this. She doesn't want to be touched.
Okay. Yeah. And a lot of horses like that, but it's not just mares, but just in general, say you're going to do the bladder meridian and a lot of times we start at the head and the horse won't even let you touch their head. They pin their ears and everything. So when that happens, it doesn't matter where you're touching the horse. There's two things you can do. You can go somewhere else on the body where they're more comfortable. So like in general, you want to start where they're comfortable and move through, then move into where they're uncomfortable. So you can go somewhere else, like you can go down to the withers maybe, and start there, and then go over the back, and then eventually they're relaxed by then. You can go to the pole. So one is go somewhere else on the body where try to find a place where they're more comfortable. Now the other one, if they're not comfortable anywhere you touch them, I like to touch them anyways, and actually give contact like you're going to pet them, because she may pin her ears and swish her tails, but rest your hand on her, say on her withers or somewhere where you feel like she's the least uncomfortable, and rest your hand there until she stops, because she'll pin her ears, swish her tails. Usually at some point they'll accept that. And then you can say I'm on her shoulder or farther down her neck, and I put my hand on until she stops fussing, and then soften and start going down the bladder meridian. Okay. And then you might get to a point where she pins her ears and swishes her tail. Okay, stop there with a light touch. So you're starting with real contact because horses are used to that. And then you'll go to light touch and go and carry on with the bladder meridian. So that might be one. I'm just throwing out ideas. That's one way to handle it, is put your hand on them until they're done, because until they're done swishing. And then slowly lighten your palm and follow down and do the bladder meridian. The other one is actually pretty cool. But it works and sometimes it doesn't. If you go up to the pole and you start to touch their up here by the atlas and they pull their head away, back your hand away until you see their eye soften a tiny bit or blink. And so stay at that distance. You can do the bladder meridian from that far away. That's where the horse is comfortable. You're bringing their awareness to some place that's uncomfortable, and you're finding that spot where they can relax. So if it's that far away, watch her eye as you take your hand away, and then when you see her blink or soften, stay there and just see what happens. And if you wait there like a minute, maybe less, maybe more, she's going to have to start releasing the tension, because you're bringing her awareness to something that's really uncomfortable in a way that she can't block it out. So those are the two ways. One is go where it's more comfortable, or back off until you see her start to relax a little bit, and then stay there, and she might start to release the tension. That would be one. The other is do a scapular release. It's in the book, or it's on a YouTube video. Do a scapular release, just even a nice, quick, easy one. Or when you pick up her foot to clean it, I'm sure she's letting you do that, or she's probably got pretty bad feet. If you're never picking up feet, pick up her leg, clean the foot, then get her to relax her scapula and drop the scapula as you put the foot down. Don't just put it down. Ask her to relax her shoulder, because when those scapular releases are most horses, it'll give them some relaxation, and then it'll introduce some so I learned some big words from Dr. Peters. Endogenous opioids, it's natural painkillers that the horse has, and they're free and they're legal. They don't test for they're natural. So if you can just get a couple relaxed drops of the scapula, go side to side, often that will, and then step back and let them feel it. Often that will relax them enough that you can do more. And then the third thing about mares, if they have ovary issues going on, that's not the place to start, because you'll get up there in the lumbar, and then they pin their ears, swish their tail. That could be just sore lumbar muscles or other things going on. But with the mares, sometimes it's something going on, ovarian issues. Especially if you stay there and they can't relax in the lumbar area, then it could be something else going on. A long answer to a short question. Sorry.
No, I love that. I was actually going to ask you that as a follow-up is, if mares do have something going on in their ovaries, what are the normal patterns that you're seeing? Is it restricted to the lumbar, or do you also see some tension in like the girth area? Do they have common hotspots that you're finding?
For in my experience, if they're having ovary issues, every time you go over the ovaries, they're going to be uncomfortable right in that spot. And so now generally, if a horse is really uncomfortable with ovary problems or ulcers, they're also going to be tight in the pole when they're really, really sore. So that's another sign when a horse just won't let you touch them. If it's a behavioral issue, it'll go away, once you actually touch them and start the work. It'll go away. But if it's something like that, ulcers or internal ovarian issues or something, they're going to be tense in the pole, and they're going to be tense, especially at the girth. Those, I call them hoof points, right where the girth goes over the pectorals. We call them hoof points, because sometimes that has to do with feet, not always. Okay. But if they have ulcers, in my experience, they react there, but up even a little higher, and could be ulcers up higher above the girth, above the pectorals. And I don't have a system for identifying ulcers. It's just, I just get if they're in a stall all the time, what's their environment, and they're in that area, they're just sore all the time, or they just don't like to be touched, tense in the whole body. So there are, I think Dr. Ridgway had on Dr. Carey Ridgway, and you might be able to find on YouTube. And there was another vet with the Portuguese name that I used to see on YouTube, who they have a system of palpating certain acupoints for ovaries. But I never got that specific. I just, get the sense, that this horse probably has ulcers. And I think they've done studies that in a certain environment, if your horse is in a certain environment for a long period of time, it's 90% that he has ulcers.
Yeah, it's crazy, ulcers. If you guys want to learn more about ulcers, we do have a webinar on that in the Online Pet Health members library. So go and have a look. It's by Dr.
I should watch it.
And it's very good. It's very, very good. He goes into like so many research articles. I learned many, many things from that. So, Jim, Lee would very much like you to know that he's here.
Hi, Lee. Hi.
It's good to have you.
I hope she's not watching from her hospital bed, because she had a really bad fall a couple of weeks ago, and so hopefully she's not watching from the hospital bed.
Lee, please let us know how you're doing.
Yeah, go to her. She has a Facebook page, and she really could use some support. So,
yeah, okay, thank you.
She organized our whole dressage movements revealed video that we made, years ago. Lee's a really good organizer. She organized the whole thing.
Wow, is that somewhere where we can find it, where we can have a look?
I think her Facebook page. Lee, do you want to put it up there somewhere?
Yeah, she's home.
Oh, no, she's home. Good. Okay.
Good. All right.
Well, she has a Facebook page,
and share the link to that, and then we can all go check it out. I think that would be great.
Yeah.
All right. So, Jim, I have this question for you originally, but I think there are a lot of professionals here with us. So, if you're in the veterinary industry, you're a veterinarian or a body worker, or you've come to the Masterson Method from somewhere else. This is for you. I want to ask you this, right? What is your feedback from integrating the Masterson Method into your existing clinical framework? How has that changed how you approach horses? How has that impacted the way that you evaluate and treat? I'd love to hear from you guys. Share your feedback in the comments, and then we can chat about that. And then, Jim, if you have had, any significant people, like anything significant that stands out for you from someone who has given you feedback on how the Masterson Method has changed the way that they practice, then would you like to share that with us?
Well, like for starters, just horse owners that just see the bladder meridian technique, on YouTube or something, and they go try it. And we've gotten lots of emails where they just had no idea their horse had so much tension, because you do the bladder meridian, and you're the horse. I don't know. The horse can't not release tension when you do the bladder. If you stay light enough, long enough, the nervous system has to let the tension go. It's like it's a state law. They have to do it, or they're in big trouble. But you're bringing their awareness to something that they instinctively block out pain and tension. So you're bringing their awareness to that in a way they can't keep blocking it out by just waiting there and keeping their attention on it and following their responses. They'll tell you exactly where it is. You might have to wait a long time, a minute or two, or it might happen right away. But when you do the bladder meridian, at some point, these horses will a lot of times just give a huge stretch and just. So I've gotten lots of emails from horse owners that they just had no idea how much their horse was holding. But then other, body workers, no matter what the modality, I think the value of being aware of what the horse is telling you with its responses, but also learning how to let the horse's nervous system release tension rather than make it. Any modality is good, and this integrates well with any modality, and vice versa. But just having that awareness from professionals that didn't have any idea that when you soften, you could get so much such good results. You ask for some movement, the horse braces. Rather than pulling or bracing, you soften. They let some of that tension go, and then they tell you. So I'm really encouraged when like chiropractors or other massage therapists come and take our course, because it's just a different way of working on the horse that you can integrate into your practice. Doesn't mean you don't do other stuff. And if you do, a sports massage or anything, doesn't mean you don't do that. You just have another tool. And sometimes rather than continuing the pressure, you can soften and add this in.
Mm-hmm. Yeah, I love that. So I could, give a little bit of my context is As a young veterinary physiotherapist, or at the beginning of my career, I should rather say, I was introduced to some of the Masterson methods, especially the bladder meridian and a few of your movement techniques. And they, although I'm not certified, so I cannot, fully say this is the impact that becoming certified has had, just having those really light methods in my toolbox, one, they're really easy to learn and to perform, and they make such a huge difference. And like you say, it's an additional thing. You're not doing the other things you would normally do, but when you get stuck or you need an alternative approach for a specific horse, or you need to start somewhere different, like with the bladder meridian, it can give you something extra that makes a really big difference. So I love that. Yeah.
Yeah, well, that's why I like to share it. I want people to try it and get some benefit from it. And if they want to learn more, then they can come and do a weekend. And if they want to learn more, they can do a 5-day. And some people choose, you can take what you learn from those and go integrate it with what you do, and hopefully improve your results, because it's about results. And the cool thing is you see as you're working on the horse when it's releasing tension. And then if you get feedback from the rider, that's better, that's even better. But then, if you want to go on and get certified or certified practitioners, it's a pretty long process, but they just get so much more practice and training. And here's another thing. All of our practitioners love to share it. So if you have a horse and you're working on it, you're having problems with it, and you do some things. If you can call a Masterson Method practitioner. They'll come work on your horse, and you're not going to be able to keep them from sharing. And they'll show you, well, maybe this is what you can do with your horse, when I'm gone, or between sessions or whatever, because their main motivation is to help the horse.
Yeah. I think that's very powerful. Thank you, Jim. Yeah. We have a great question here from Ellis. Hi, Jim. The Netherlands say hi. Could you talk a bit about the relationship between the different body parts and how Masterson Method works on, say, one junction, and suddenly somewhere else in the body, the relax modus is activated? What a great question.
It's interesting, because when I first started working on horses, and I would notice that, like, sometimes when you're releasing tension in the pole, and I'd heard there's a connection between the atlas and the sacrum, probably it's craniosacral connection, if nothing else. But then I would be working on the pole. Maybe I get a little movement. I step back. You step back to see what the horse has to say pretty regularly through the session. You don't keep working. You step back, give the horse's nervous system time to process whatever change was made, and see what they have to say. So, you step back and see if they drop their head and lick and chew or something, or they start yawning. But I'd be working on the pole, and I'd step back, and they might drop their head and lick and chew, or maybe yawn. And then the hind end would wobble behind. I stand on this leg, not on this, when they're relaxed and they're trying to find, so that they're relaxed. When you see that, it's working when you're working on the pole. Another example would be working in the lower neck here, down around C7, T1, or sometimes the withers. And you'll be doing just light work there, or movement. You step back, and the horse you'll see him stomp the ground with a hind foot. And then you'll do some more, and he'll stomp the ground or kick at his belly. So there's a connection, and I don't like to study too much. I just like to get it from the horse's mouth. There's a connection, probably a fascial connection between the hyoid, the sternum, and this junction, and up into the groin. So you're working up there, and you see the horse, a pattern of stomping the hind foot or kicking at the belly. There's something going on in the groin. So the horse is telling you something's going on in the groin, or maybe even up deeper, or maybe that, which leads into the geld scar issues. There's something going on back there that he's feeling, that you brought his awareness to. So those are a couple of big examples. And you do that, you step back and you see what the horse has to say, but you look at the whole body, because I learned it's all interconnected. And when we work on a horse, my horse has had shy, he's sore in the pole. We don't just do the pole, we do the whole horse, because you can't just loosen up one area and then allow the rest of the horse to tighten it back up again.
I love that you mentioned that. If you guys want to understand that relationship between the tongue and the hyoid and the pole and the hind end, there's so much that goes into that, and we did write something on it. So I'm going to share that in the comments, and you can go and read and go into the anatomy and those connections if that is something that's interesting to you. So I've just popped that in the comments. Um, all right, so we have a few great comments here. D. Wesley says, since I stumbled across this method many years ago, I've started and ended my sessions with the bladder meridian. Excellent results and responses. Thank you,
Mm-hmm.
D. Let me see. Angela says the Masterson method has changed how I show up for the animals I work with. I'm aware of the energy I carry and how I use my energy to interact with them. I think that's very powerful. Jim, do you want to talk a little bit more about how we show up and the energy that we carry?
Yeah, when you start paying attention, even before you start working on the horse, even when you just approach the horse, you start become automatically trained to watch the eye or to watch the horse's whole expression. You know, its posture, its tension as you approach the horse, and so you learn. Right now, I've learned. I mean, when I approach the horse, I don't just approach the horse, and I don't approach the horse carefully. I don't, I don't know. Okay, everything's fine, because then the horse is going, why? What's not fine? You don't. It's not like that. Just approach the horse one step at a time, and just stay calm in your body, and just watch the eye. So you get pretty good at approaching the horse at the speed at which the horse is not bracing. You know what I mean? You just become aware of that because you're learning how to read the responses. And that's what, energy, everything is energy work, but, I'm not a student of energy work, but everything's energy, right? So, but I am really conscious of being aware of how the horse is being aware of me, and it just starts to happen automatically. When you do the meridian, for example, you start to, pretty soon, your mind quiets down. Like the bladder meridian is almost like a meditation when you do it on the horse. You'll find yourself slowly going down and waiting on a spot, and you're waiting for a response, like a release response. And you realize, wow, I'm not thinking anything. This is really relaxing for me. So pretty soon your energy starts to change. So it's pretty cool. And it all comes from the horse, Yeah.
Yeah. They're the best teachers.
Yeah.
Yeah. Leah says, hi. I just want to say, learning MM and becoming an MMCP has changed my life, and I'm forever grateful to Jim for offering this wonderful way of being with horses to all of us. It's really worth it.
Yeah. It is. Well, I think it's worth it anyways. But a good thing about it is you can just go to the YouTube and just start learning stuff, And I mean, and trying it and see if you get results. I like to approach it that way. I don't want somebody to buy a course or buy something or the book or anything if it's not going to benefit them. So anyways.
Exactly. Yeah, no, exactly. That's really been my experience, is the little bit that I've been able to learn from the people around me, the people who are certified, and the resources that are available for free. Those techniques are really powerful and have made a difference for me. And so I love that. Okay. So Jim, can you actually tell us just briefly where people can learn more about becoming certified, or potentially Sonia should pop that into the comments, and she can share a link and more information on that. Would that be better?
Yeah, our website, and our website, it tells you all about, what courses we offer. We have the book Beyond Horse Massage and the DVD Beyond Horse Massage that show you those are basically the techniques that we learn on a weekend course. Okay. So that's a good place to start. If you like, if it's a streaming video or DVD, if you're more of a watching person, I'm demonstrating all the techniques, but the book goes into more detail, a little bit about the anatomy and the key junctions and a good part of what I like about the book, there's a section after each technique you learn about what ifs, what if when you go to do something, my horse starts throwing his head around, what if, so that's super valuable because you can, if everything goes according to the book, great, or the DVD, but what happens if it doesn't? Because some horses are more challenging than others, right? So that's the best place to start, or YouTube, or just watch some of the videos, go try them. And then the next thing is the book. And then the next thing, we do a weekend course. We have instructors all over the world. And then we have the 5-day advanced course, which goes into more practice and learning a few more advanced techniques and our evaluation techniques. And then if you want to do certification, we have the fieldwork program, which is interactive case studies. You do case studies, you send them into a mentor, you get feedback. and you'll do 3 blocks of those. It takes a while. Some people think, oh, only 30 horses, I can do that, but you're going to get feedback along the way. And you're going to work with in-person coaches at 3 points during that process. And then there's a final certification course. And that's how the whole process goes. But you don't need to become certified. If you can just learn what you want to learn. It's a step-by-step process.
I like that. Okay. So Sharon, you've asked, where can I find the ulcer information that we discussed? So if you're familiar with online pet health, we have a membership portal for veterinary rehabilitation therapists around the world. And that has a library of hundreds, I think we're over 700 webinars right now within that library, and they're all presented by professionals in our field. One of the recent ones is with Dr. Ben Sykes, where he goes into equine ulcers and he discusses the different kinds, how we can prevent them, because it really is something we need to be working on preventing, and then what do we do when they are present. So that is available in the Equine members library. If you want more information than that, pop us a message. If you are not a member, then you can pop us a message and we'll give you more information. But yeah, all of our webinars are available to our members within the library, which makes it really, really convenient. So hopefully that helps you. Jim,
I like that point where you want to learn you want to prevent them to start with. That's the first. Yes. But you also want to identify when they have ulcers so you can treat them too.
Yeah.
Sorry.
Oh, this is a great question also. So hello, Shelley from Washington State. For a complete beginner, would the bladder meridian be a good place to start?
Yeah, excellent place to start. That's where to start.
Yeah. Okay, and Masterson Method has shared with us a PDF resource that I'll be sharing with you guys this week. So follow the Masterson Method page and follow the online pet health page. And when that resource comes available, it's free and you guys can grab it. And we'll be sharing that on social media in the next few days. So just keep your eyes open. That's going to teach you how to do the bladder meridian. Okay. Before we finish up, I think we would be remiss if we don't touch on gelding scarring. So the webinar that you present with Vanessa Halvey for our community this month, it's a free webinar for everyone to attend. So you guys, if you haven't watched it, comment gift and we'll send you that link to the webinar. If you have watched it, that's fantastic. Let us know if you have questions or what you thought.
Oh, I need to do that. I need to do that because there's a lot to that issue, and I might want to get a reminder of what we were talking about. But it's like geld scar isn't just about the scar; it's a lot about what else is going on in that system. So it's really important and also to learn how to identify when it might be an issue with your horse, because a lot of hind end issues stem from that hind end performance issues. Sorry.
Yeah.
I'm good at interrupting.
No, please. No, you can interrupt anytime. That's how this works. So Jim, just talk a little bit more about gelding scarring. What is your favorite treatment technique, actually? Can you share that for gelding scars? Is there something specific that you like to reach for, or that you reach for more often than others?
Everything, and they're a little bit of a mystery, because you can have other issues that if they've had an issue with the gelding process, it can be something that's really obvious right away, or it could be something that's not so obvious, that's just going to be there, and over time, especially if the horse is in training or work, might make build and build and build and build. And it's a groin issue because starts as a groin issue because it's in the groin, but the first thing is if you can get the horse's hind leg relaxed and then rest your hand lightly in the groin, if the horse lets you do that. And sometimes if it's an issue that's bothering them right now in the moment, then they'll be uncomfortable and they won't let you put your hand in there until you do more bladder meridian or more hind end points to get the horse to relax, and the pole. Don't start to work on the groin until you've relaxed the whole horse. That's like one of the later things to do, but just bringing their awareness to that tension in the area by resting your fingers lightly in there. But it's tricky, to feel. You may not feel what's going on the surface. It may be more internal. So it may show up in the lower back. because that's where the process starts. That's where that's where the gonads start, and then they drop eventually, and then they become the testicles, and then somebody comes along and removes them. So it's that whole system in there, and it depends how serious it is. So the webinar or the talk that Vanessa and I did was really, really helpful in understanding what's going on with the geld scar issue. It's not always just the scar. Oh, you disappeared. I lost you, Annie. I'm sorry if I'm still on and you're on. I just lost Annie. Do I have my internet connection? Yep, I do.
Sorry about that.
Oh, there we are.
Were
Okay,
you okay?
I lost.
They calmed out.
Yep, I lost you. We're back.
Okay.
Anyway, so it's not it's a complex problem. It can be, but for me, the first step is to be aware that if you have a mystery, I call it mystery hind end issue. There's just something going on behind, and you can't find it or solve it. It's not in the feet and legs. It could be groin strain. For me, my experience, just a strain in the groin muscles, the deeper ones. Mm-hmm. Or it could the gelding scar could be part of the problem or a main part of the problem, and depending how serious it is or how long it's been there, and sometimes it requires a vet that knows how to do it or an osteopath to go in rectally, and sometimes they can manipulate things, but often you can release the tension in the groin. Just release the tension in the groin. In general, often that will help. It might not be that serious that it's way up in there. But the talk with Vanessa really goes into it. Vanessa is really good at geld scars.
Okay, super. So to everyone who has commented gift, if you haven't received the link, I've decided to pop it up on the screen because I think that is going to be easier. But it is simply onlinepethealth.com/gift. And you're going to be able to sign up for that webinar with Vanessa Halvey and Jim Masterson on gelding scarring and watch that for free. And that is our gift to you in celebration of our 9th birthday.
Happy birthday.
Thank you so much.
Well, it's only 10 a.m. here. I'm in Arizona at the moment, but as soon as it reaches 3 or 4, I'll go have a beer to celebrate your
have a beer. Birthday. Thank you. We celebrate our birthday for the whole month because that's
cool. I can do that every day then.
Yeah, every day, exactly. We actually haven't had cake yet this year, so I'm gonna have to talk to my team because the birthday cake has not yet appeared. All right, guys, I think we are going to call it there for tonight. We are just at an hour. Jim, it's been really amazing chatting to you. Guys, please continue to comment, share your questions in the comments, and we'll see if we can get answers to those for you and to guide you in the right direction. Make sure that you're following the Masterson Method Facebook pages. Check out what they're doing. Learn more about the method. It really is worth integrating. Make sure that you're following our page, Online Learning for Equine Rehab Therapists. If you're not there yet, we're always sharing continuing education in different formats. And it's all about community here and about bringing us together and supporting the people in the industry. So, Jim, thank you so much for today. I've really enjoyed chatting with you.
Yeah, you're welcome. I enjoyed it too. Thanks a lot.
Bye, guys.